Hello friends. So today we are going to discuss about the case study based questions, which will be long answer questions, short answer questions and the multiple choice questions. So the NMC has reviewed the pattern of questions and the questions will be more of clinical. So we will discuss today the case studies based questions and we will answer them. So the first question, the first case study rather is a 14-year-old child with type 1 diabetes mellitus is admitted in emergency department with history of vomiting, sweating, dizziness and hyperventilation. On examination, he has signs of dehydration, that is, you all know that is dry skin, sunken eyes, less urination. On interpretation of lab reports, we have found that the blood glucose level is 687 milligram per dl, which is very high. Now the sodium is 135, potassium is 4.6 and chloride is 102. The ABG report shows that the pH is 7.1, PCO2 is 40 mmHg and bicarbonate is at 8 milli equivalent per liter. Now, what could be the questions? The first question will always be like, what is the diagnosis? So you have to make the diagnosis. If you watch my previous lecture, you will be easily able to make the diagnosis. Now the second question is, find out the cause of acid-base disorders, and the same lecture will tell you the cause of acid-base disorder. What is the cause of hyperventilation? You all know that, the compensation mechanism, which is discussed in the second lecture, and role of kidney in regulation of pH. So pH is regulated by kidney in metabolic compensation, and that will also you will find in my previous lectures. Now let's come to the short answer questions. What is the metabolic acidosis? So I know that nobody will know better than you what is metabolic acidosis, because you have watched all my 3 lectures. Now define HAGMA, that is high anion gap metabolic, and that I have given you the mnemonics for that, and you will definitely find out in the mnemonics the 2 conditions or 2 diseases with high anion gap. Now the third question is, explain NAGMA, normal anion gap metabolic acidosis. You know that, and name 3 diseases with NAGMA. So again, the mnemonics of NAGMA is been already taught to you. You can find out in there the 3 conditions in which NAGMA happens. Now let's discuss the second case studies and the questions related to that. So a 48-year-old female was brought to A&E with a complaints of persistent vomiting, and for the last 1 week she has generalized muscular cramps. On examination, what you find, that is she is dehydrated and she has shallow breathing. The respiratory has gone down, and that is 12. Now we have done the ABG, and APG report shows that the pH is 7.8. PCO2 is 50 mmHg, sodium is 145, potassium is 2.9, bicarbonate is 28 milliequivalent per liter. Now what is the diagnosis? So for making diagnosis, I have taught you that there is a formula Rome, so you can understand this by what will be the diagnosis. Go and watch my previous lecture. You will be easily able to understand the acid-base disorder, and you can be easily able to make the diagnosis as well. So now the second question is, identify the nature of acid-base disorder. So this is actually, the questions are the same. Either they can ask you the diagnosis or they can ask you the nature of acid-base disorder. Now the third question is, what is the reason for cramps? So I have also explained that, and you will be easily explain the answer, the reason for cramps. And the fourth question is, explain the compensatory mechanism of acid-base disorder. Precisely here, you have to explain the compensatory mechanism. So you can again watch my lecture, the compensation of acid-base disorder, and you will be able to answer these questions. And why the respiratory rate has gone down. So that is also a part of compensatory mechanism, and that will also you will come to know after watching my second lecture. Yeah, second lecture. So now we will solve the multiple choice questions, and I have collected only 4 questions which will actually tell you the basic ideas and basic concept behind the asking of questions related to acid-base disorders. But you have to practice more and more questions. You can buy any book from the market which is readily available, and you will solve the case studies and questions. You should also start solving the multiple choice questions to get hang of the ideas and actually the topic. So now we will solve the multiple choice questions, and I have collected only 4 questions which will actually tell you the basic ideas and basic concept behind the asking of questions related to acid-base disorders. But you have to practice more and more questions. You can buy any book from the market which is readily available, and you will solve the case studies and questions. If you want the free PDF copy for these questions or the more questions which I have collected for you, you can always write to me on my email ID, which is drmfiles@gmail.com, and what I will do, I will push you the free copy of these lectures as well as the questions related to these. So now let's start solving the MCQs. So the first question is, metabolic acidosis is primarily due to increase in carbonic acid, decrease in carbonic acid, decrease in SCO3, increase in SU3. So I know that you know the answer of this, and if you have any doubt, go back to my lectures, watch it, and you will get hang of it. Now, the second question is, in compensated metabolic acidosis, what happens? That is the idea of the question. The choice first is bicarbonate upon, basically the ratio of bicarbonate and carbonic acid is increased, total oxygen concentration decreased, bicarbonate and carbonic acid ratio decreased, none of the above. So you can also solve these questions very easily if you have watched my previous lectures. Now, all of the above is associated with metabolic alkalosis except, so metabolic alkalosis is talking about pH, talking about the kidney, so you can understand. The first choice is rise in blood pH, rise in bicarbonate plasma level, loss of H plus ions, decreased in bicarbonate plasma level. So I know you can solve it very easily. The third, the last question, that is fourth one, is metabolic acidosis is associated with first increase elimination of H plus ion in urine. Second choice is increased formation of ammonia. Third choice is increased respiration. And the fourth choice is diminished formation of ammonia. So I hope you can understand by solving more and more questions of multiple choice type, and you will definitely, like I told you, get hang of it. So next lecture I will discuss about the LFT and precisely jaundice. ये बहुत ही इम्पॉर्टेंट टॉपिक है। ये एक मेडिकल स्टूडेंट्स के लिए भी, एक आम आदमी के लिए भी और एक डॉक्टर्स के लिए भी ये बहुत इम्पॉर्टेंट टॉपिक है। सो आप लोग प्लीज़ हमारा नेक्स्ट लेक्चर ज़रूर सुनिएगा, मिस मत करिएगा। थैंक यू।